across your lifespan, but especially maybe some behavior changes you could make right now and be more healthy as undergrad students. Okay? So what I've done is I've picked out a few pieces of information that I just wanted to highlight to you because they're particularly linked to your immediate health and wellness, and a couple of these ideas are also things that follow through on other classes. So that doesn't mean the rest of the chapter isn't important, it's just can't cover it all, and I really would like some time for a little discussion after the PowerPoint slides. Anytime you've got a question, please unmute your microphone, jump in, ask a question. Let me know who you are, because obviously when I've got the share screen up, I can't see whose microphone has turned on, okay? So introduce yourself if you've got a question, and yeah, let's get going and see. Hopefully some of this is really new information and will be very interesting for you. All right, let's share this screen. Oh, the other thing, so by the end of last week we were having some really quite debilitating connection problems in here. I don't know whether it was ENMU's internet, whether it was the Blackboard company I don't know what was going on. But one of the classes we recorded, actually most of it is silent because my microphone had been turned off by the reconnection. So if I go quiet, guys, someone jump in and let me know so that I can reconnect my microphone, please. Okay? Super. All right, here we go. Okay, so chapter 1 is just an introduction to the whole idea of health and wellness. And that's a good start. The clicker's not going to work. Yay. Again. Should work. Okay, so first off, let's have a look at these terms that the class is named, right? Let's make sure we understand the difference between health and wellness. So our health, if we are in good health, then the idea of that is we can really function independently in an environment that changes regularly, right? So it's different in my house to it is in the classroom, to it is in the supermarket, quite apart from the fact that right now we're dealing with this pandemic, okay? So the idea for health is that I can mitigate some risk factors by modifying my lifestyle, right? So you may be aware that there's a genetic history of a certain risk factor in your family, okay? And if you know about that, then you can choose to make some changes to your lifestyle that maybe will prevent you developing the disease that that risk factor is connected to. Depends on what the genetic history is and what the disease is, obviously, but certain diseases are very manageable if I have a healthy lifestyle, okay? Wellness is the idea that I'm functioning at my optimal capacity, right? Not just that I'm functioning independently, but that I'm functioning optimally, all right? That my cardiovascular system is as healthy as the amount of work I'm prepared to put in to make it, right? That my digestion is working well, that my respiratory system works well, okay? So for many people, the idea of a holistic approach to health and wellness, so it's not just physical, it's not just mental, but we've got to look at the person as a whole to truly make them well. Right? If you look at figure 1.2 in your book, which is right at the beginning of this chapter, it's on page 6, they have an interesting continuum there looking at health and well-being. So on one end of the continuum, we have optimal well-being, optimal wellness. And on the other end of the continuum, we have premature death due to loss of function or disease risk. Right? Premature death is considered, in this day and age, premature death is considered before 75. Okay? Why is this not clicking? It's not one thing, it's something else. So I've got a couple of clips here to show you because I wanted to maybe challenge your idea of what healthy is, because you might have a picture in your head that that indicates, oh, this, healthy for me is someone in their 20s going out for a run on a nice day. Okay, so I wanted to just give you a couple of examples that maybe will make you think a little differently. Tell me, I'm going to click on this, it should open up for us. And I'm hoping you can see this YouTube clip. Please let me know if you can't. Oh, what did I do? I broke it. Here we go. Pretty impressive, huh? He looked pretty healthy, I thought. All right, let's have a look at the other one. So what do you think? Right? I hope I'm that healthful, I hope I live that long, and I hope I'm that mobile and that healthy when I get to their age. I'm not sure I'm that mobile right now, actually. So that, I thought, you know, those two clips give us a broader approach to what we consider to be healthy, hopefully. All right, so this idea of wellness being holistic. In our textbook, they have a 6-dimensional model. I just wanted to introduce you to the fact that there are different models out there on wellness. This one is 8 dimensions, and the additional 2 dimensions that our model in our book don't have are the financial domain and the occupational domain. So what is your satisfaction? What do you get from your job? Does your job stimulate you, or is it boring? Right? Does your job enrich your life, or does it pull you down? Right? And then financial is your perception, your satisfaction with your personal finances, and maybe your plan for the future of your finances. Okay? So this is the model that is in the book. I like this version actually because they've managed to overlap all the dimensions together to show how important they are and that they interact with each other. So we have physical health, we've got the environment. Yes. Sorry?
I'm sorry. I'm Elizabeth, and it says that you're sharing content, but I'm still on the first slide.
Sorry, can you say that again for me?
Yes, I noticed that you're on like the 8-dimensional model, but on my screen it's still showing that I'm on the health and wellness concepts.
The very first slide?
Yes, ma'am.
Okay, thank you for letting me know. Let's go back here and see. Okay, it shouldn't be. I'm looking at the share screen in the classroom, and it's on the health and wellness, and it didn't move forwards. I see. Were you able to see the YouTube videos?
Yes, I looked on your screen to see it on your actual like projector screen or whatever, and I saw the videos.
Okay.
But on the 8-dimensional model, I didn't see it because it's like kind of blurry.
Okay. So why is it stuck on there? I wonder if it's something to do with that, because this PowerPoint is the one that came from JD Learning, and I've adapted it. So I wonder, because it's not clicking either, whether there's something weird with their PowerPoint. Okay, hold on. Okay, can you see that now?
Yes, ma'am.
The 8-dimensional one. Okay. How very odd. All right, then I'm going to have to do this slightly differently. So I need to keep this in normal mode, not in slideshow mode. Okay, so now you can see the model from the textbook.
Yes, ma'am.
Okay, thank you for letting me know.
Sorry.
This is all very unsettling, this whole scenario. Never mind, we're gonna be so amazing at technology by the end of this semester. It'll be super. All right, so I was saying, one of the things I like about this model is the fact that they overlap everything to indicate that we really can't isolate wellness just to one portion of our life. And this particular model puts psychological, social, spiritual, intellectual, and physical within the context of your environmental health. And so what they're suggesting for this model is that environmental health impacts your wellness more than anything else, that the conditions that someone lives in, the conditions that they have to work in, is an overarching impact on all the other domains of wellness. So I think about that as you're working through when we get to the discussion piece, because I think that's quite an interesting idea that my environment has that much impact on my wellness, because it means that I have to pay attention to keeping my environment a safe, secure space, right? We talked about that last week, that we're going to make this classroom a safe and secure place for people to have an opinion, and that we don't have to agree with each other, but everyone is allowed their opinion, and we can disagree, but we don't have to attack someone for having a different opinion to us, right? That we're going to be respectful of people's opinions. People's opinions are based on their perception, their history, right? Their background. So it's not appropriate for me to judge someone else's opinion because I don't know where they've come from. I don't know what they've been through that produced that, right? Okay, I don't think this will work. All right, just a little bit, just to give you some idea of the health status, physical health status. But this is 2017, I think maybe 2018, that might be the wrong year. So the CDC, the Center for Disease Control, produces these prevalence maps about once every 2 or 3 years. And you can go to the cdc.org and have a look at older maps, although they're suggesting that you can't necessarily compare them anymore because the way they're reporting the data is slightly different now. But the interesting thing when you look at this is the prevalence of self-reported obesity in adults, all right? So we don't have any state anymore in North America that indicates less than 20% of adults are obese. Hawaii, Colorado, and Washington, D.C. are the lowest states, and they are at 20 to 25% adults reporting obesity. And Colorado has, in all the maps I've seen back to 1995, Colorado has always been the least obese state. So think about that when we also think about environment, right? Think about one of the great things about Colorado is I can be outside and be active all year. In the summer, there's hiking, there are bike trails, right? In the winter, there's skiing, there's snowboarding, there's cross-country skiing, right? There's always something to do there. Okay? The yellow is 25 to 30%. The dark orange is 30 to 35%. And very alarmingly, we now have greater than, equal to or greater than 35% reported obesity. And 1, 2, 3, 4, 5, 6, 7 states are reporting greater than 35% of adults are obese. Right? That's a little scary, I think. Because one of the things, and this will come up again, think about if the parents are obese, then it will be that much harder for a child growing up in that household not to be obese, right? Because the parents probably don't move very much. When they do move, it's not going to be at a very intense level. They may not be eating very healthily, and so the child is not going to be eating healthily. So there's a big problem when we look at this data with the overall health of individuals. So, your book goes into some detail about Healthy People 2020, which is a government agency proposal. They started it in 2000. So back in the late 80s, early 90s, people were starting, especially by 1995, because we had the prevalence maps then, people were starting to go, uh-oh, things are going in the wrong direction here, right? Healthy People 2000 had 3 general goals. Not very many states met that, and so they developed a set of goals for Healthy People 2010, and not a single state in America met the goals, not even Colorado, met the goals for Healthy People 2010. And so now we have Healthy People 2020, and we're there already. It's gone so fast. There's no data reported yet. It'll take a while to collect all that data and for us to find out whether any of the states met the new goals. But the 4 primary goals were to try to provide high quality, longer lifespan, less disease, and premature death for everyone, right? Achieve health equity, eliminate disparities, because the health disparities in this country are huge, okay? And improve the health of all groups. So not just white, middle class, rich people, everybody, you know, white, poor people, people of all minorities, you know, who don't have access to equivalent health care, okay? And even here, right? I believe one of the reasons the students could not come back to campus, one of the reasons that the senior administration changed its mind on that, is probably because the Roosevelt General Hospital in town has 2 ICU beds, and they have 4 working respirators. So there was no way that our local hospital could manage an outbreak on campus, right? People would have had to have been farmed out all over the place. I think the plan was to farm people down to Roswell, to the hospital down there, right? So even here, you know, we're looking at healthcare disparity because of the size. We have a hospital, but because it's a small hospital, it can't manage what could have happened if the students had come back to campus, right? We want social and physical environments that promote good health for all. So, lots of park space, lots of safe open space to be physically active. Promote quality of life and healthy behaviors. Okay? So the goals are not kind of way out there and weird, right? These all seem reasonable and one would hope achievable, but we'll find out whether or not they were actually achievable. Okay, a little bit more about this idea of health status and disparity. The health data that is collected in America is based on race, ethnicity. But there's more to it than that. How much I earn, so my socioeconomic status, whether or not I work in a job that provides health insurance, how far did I get through school? Did I drop out before I finished high school? So the more educated you are, the more likely you are to include good health behaviors in your lifestyle. And how long we've been living in the United States. So for minority groups, the health status of the parents or grandparents who came to the States is not as good as the health status of their grandchildren and great-grandchildren who were born here and have spent their whole lives here. Okay? Having higher levels of education typically leads to a job that pays a little bit more and is more likely to have health insurance. Okay? In this country, it's different. In the UK, where we have the National Health Service and we have free healthcare for people. Although, you know, it's easy to say that, like, everyone should have that, but you have to remember that England would fit inside Alabama, right? So, philosophically, I believe everyone in the state should have free healthcare. How you actually achieve that, given the size of your country, that's a whole other kettle of fish, right? So, Hispanics are the largest minority group in the States. 25% of Hispanics in the States have very low economic incomes. huge disparities in disease. So 25% of them are living in poverty. African Americans, blacks are the next group. 25% of African Americans live in poverty in this country. So that's a huge number of people who have difficulty taking care and of their health and their wellness. Right? Asian Americans, interestingly, are less likely to indicate risk factors for disease such as cardiovascular disease, even the white Caucasian, whatever political term you want to use. I think we're back to white and black now. It changes regularly. I can't keep up. But yeah, Asian Americans actually have the best health outcomes of any group, even though they're the smallest group in the country. So, questions, comments? We've got time to do a little bit of chat, and I'd like you to read something in your books, those of you that have your books. I know some of you have had trouble getting them, they're coming today. Any comments? So think about, maybe this is something that happens as we get older. I can't remember if I thought about it when I was your age, but I look back now over my family, and my grandparents left school very early. They both had jobs. They lived in council housing, which is a little bit like, I don't know what you would call it over here, low-income housing. I'm not sure what the technical term of it over here is. So they didn't own their own house. And they never really went on holiday. They certainly never left the country other than for their honeymoon. If they went on holiday, it was something very cheap, like down to Brighton for a week or something like that. I mean, all they did was work. My mum won a scholarship to a grammar school, so that's a grammar school's like a higher level of education in the UK, and she won a scholarship there. So obviously my grandparents weren't dumb, right? They were smart people, otherwise my mum wouldn't have been smart enough to get a scholarship. She actually had to leave school before she finished school and go out to work because my nan and granddad needed help with the house. My dad's a single father family, and so I'm looking at my background and going, well, I'm pretty lucky, really. Here I am now. I have a PhD. I have a great job. I don't even live in the UK. I've traveled a lot in my life, and when I look back, no one would ever have imagined that this is where this generation, my sister and I both went to college. I was the first person in the family to go to college. And then my sister followed, right? It's not that long ago that my family were really low socioeconomic status. They were working class in the UK, right? And I would be considered middle class, possibly upper middle class now, because of my education, right? So it's really interesting when you think about these variables that impact your health and wellness. That there's an element, I think, an element of luck, maybe, in there, right? That I just happen to have parents who had a better education than their parents did, and they thought that making me and my sister have a good education was an important thing, right? Okay, how many of you have a textbook that you can access? Let me get rid of this and come back to you guys. How many of you have a book that you can look at? Isaiah, did you have a question? You have one? Okay. Well done, that man. Anybody else? Ha. Okay. Kendrick has one. Will has one. Maricela. Okay. So, I don't know if this will work, if not everybody has. Oh, Dean has one. Okay. Let's give this a try. And then again, you know, I really would appreciate your feedback on this because I don't want Mondays just to be me talking. I want it to be interactive for us. And so I was thinking of setting up little discussion groups, but it's hard to know who's going to be available. Like there are 26 people in this class and there's 15 people here. So if I set up a group and no one shows up, that's not going to be very much of a discussion, right? So if you have any ideas on discussion stuff, let me know. What I'd like, those of you that have your book, go to page 14 and have a look at the diversity in health item. Each chapter has a diversity in health item. They're really interesting. So this one is about minority health status. So if you identify as any of these minority groups, then I'd like you to read that section and give me an opinion on what you think about that section. I don't know in this class if we have anyone from a reservation. If we do, that would be cool. I know I do in my other class. So Hispanic, Latino, Black, Asian, Pacific, American Indian, Alaska Natives. If you identify as, don't worry, okay, so we've got a couple of things coming up about the quiz. If you have not received your book, right, the quiz shut this morning, drop me an email. I can reopen the quiz for those of you who were unable to take it effectively or at all. Right? Just let me know. That's easy to do, I think. And if it isn't, I will ask how. Okay? If you identify as white, then I'd like you to pick the minority population that you have the most interaction with, maybe. Right? So take just a couple of minutes. We're not going to take too long because I want some feedback from you on how to organize this in the future. If you 15 are going to be here every Monday, then I can just divide you 15 up and the others can take their chances. Okay. That should be enough time just to get a feel for what the book is saying there. Do we have anyone in class who would identify as Hispanic or Latino? Oh, good. Okay. So Isaiah and Maricela, lovely. So if you can turn your microphones on, I'd be really interested for you to share what you think about what it's saying. Can you recognize what they're talking about in your own communities?
I think that it's pretty interesting that 21% don't have insurance.
Yeah. It's a little upsetting, isn't it? Because especially when you look at what we're going through now, right? Although hospitals are trying to provide free healthcare for COVID, what happens? I don't know how much you guys have been reading about the outcomes of COVID, but a lot of people are saying that once they've recovered from the initial illness, the fever, the really being unwell, that there are quite a lot of negative effects that last weeks, months. So people are having trouble breathing. Some people have lost their sense of smell, doesn't come back for a long, long time. So they might have got treatment when they were really unwell, but now they're just not, they don't feel good, they're struggling with breathing. Now they don't have health insurance to go back and get more help, right? 21%, that's huge, huge. What about anyone identify as African or Black American, or just African or Black? Because not all of us come from America. Have we got anyone in that group? No? Okay. What about Asian Pacific? Or native? Okay, in that case then, what I'd like you to think about for the next couple of days is consider, do you have friends who would identify as one of those minorities? Or do you live in a community that has a number of people that would identify with one of those minorities? Okay? And just think outside our own box, but also pay attention to the fact that this education that you're embarking on could make a massive difference to the quality of your life, and if you have children, then to the quality of their life. In the future. So, think about, it doesn't actually matter which group you identify with. Anyone with more education is likely to have better health status during their life. Okay? All right. I did want to say, if anyone is actually in Portales, Friday's isolation activity is going for a walk for 30 minutes. I am going to go to the Portales walking trail to do my 30 minutes. So if you're in Portales, you could come and join me there, and we can wear our masks or make sure that we're far enough apart that we don't necessarily need our masks. Make sure you have a mask with you, because if there are other people on the trail, we will have to wear them, things like that, okay? But if you would like to come and walk at the trail with me, that would be great to actually get to meet you. If not, be thinking about, where am I going to do my Friday morning activity, okay? Wednesday, I am going to open the classroom, and I'll be in the classroom, but Wednesday is your day to finish reading the chapter thoroughly, to answer the application questions at the end of the chapter, and to put those answers in on Blackboard. And then you could also use Wednesday to do your self-assessment and changing health habits if you want to. All right? Then if you've got any questions, you can jump into the classroom and I'll be there, and I can answer any questions for you. I hope that made sense. Anything else? Anybody last minute question or comment or thought about these ideas from today? Okay, all right, well, we are done. And as I said, Wednesday, you're doing your work. If you have questions, I'll be there. This afternoon I have office hours, so if you think of something and you want to ask, you can jump into office hours this afternoon. okay? Otherwise, hope to see some of you Friday, but if not, I'll be looking forward to watching your little clips of video for Friday.